ITS in collaboration with ASST Bergamo East, Cardiac Rehabilitation Department of Siriate Hospital. Dr. Giudici, Viscardi, Regazzoni and Rizzola realized the course, Telehealth, Televisiting, Telemonitoring and Other Applications. In this course, we will talk about telehealth, why it is important, what is needed to implement it, and above all, how to do it with practical examples and demos. These are the aims and objectives for the modules. Module 1 Introduction to Telehealth. In this first module, we will discuss the importance of telehealth and the advantages it brings to clinical activities. We will then proceed to define the different types of telehealth applications. With these foundations, we will be able to delve into the more practical aspects throughout the course. Module 2, Building a Telehealth Clinic. In this module, we will discuss some implementation aspects about medical and nursing personnel you need for a telehealth project. We will describe the hardware and software technologies and requirements for activating telehealth services. Module 3, Step-by-step actions to implement telehealth. In this module, we'll delve deeper into the different types of telehealth applications, such as televisit, telenursing, and teleconsultation. We'll face the different goals and processes implementing the telehealth system. With some examples, we'll talk about some typical criticalities. So, let's start with the first module. The ongoing evolution of demographic dynamics and the resulting changes in the healthcare needs of the population, with an increasing number of elderly individuals and chronic conditions, necessitate a structural and organizational redesign of the service network, especially with the aim of strengthening the territorial scope of care. Technological innovation can contribute to the reorganization of healthcare, particularly by supporting the shift of healthcare focus from hospitals to the community through innovative care models centered around the individual, facilitating access to services nationwide. The delivery methods enabled by telehealth for healthcare and social care services are crucial in this regard, ensuring equity in access to care in remote areas, supporting chronic disease management, providing access to specialized care, facilitating continuity of care through multidisciplinary collaboration, and serving as a vital resource for emergency services. Telehealth tools offer innovative solutions to traditional medical challenges and enhance healthcare services by fostering collaboration among healthcare professionals and patients. The following are the main motivations and expected benefits driving the development and adoption of telehealth techniques and tools. 1. Equity of access to healthcare. 2. Improved quality of care by ensuring continuity of care. 3. Better effectiveness and efficiency. 4. Cost containment. Equity of access to healthcare. The use of telehealth can increase equity of access to qualified healthcare in remote areas, contribute to improving healthcare in correctional facilities, manage long wait times for diagnostic or specialist assessments, and limited preventive diagnosis activities. Improved quality of care by ensuring continuity of care. Telehealth aimed at bringing medical services directly to the patient's home, without the need for the doctor to leave their office or the patient to travel, is closely related to this motivation. The care of chronic diseases can be a priority area for the application of telehealth models. Telemonitoring can enhance the quality of life for chronic patients through self-management and remote monitoring solutions, including early discharge from hospitals. Better effectiveness and efficiency. Telehealth improves communication among different stakeholders, guides providers toward appropriate resource utilization, reducing risks associated with complications, hospitalization, waiting times, and optimizing resource utilization. Timely and synchronous information availability also offers the opportunity to measure and evaluate healthcare processes using process and outcome indicators. Cost containment. Electronic health encompasses the use of ICT to support the entire range of operational functions and processes in the healthcare sector. One of the advantages of new telehealth-based organizational models is the potential rationalization of socio-health processes, which can have an impact on containing healthcare costs and reducing the social cost of illnesses. Impact of chronic diseases on the national healthcare system. The rate of chronic disease and the resources required for its management strain the healthcare system due to the resources and costs associated with care. Chronic diseases, including cancer, diabetes, hypertension, stroke, heart disease, respiratory diseases, arthritis, obesity, and oral diseases, can lead to hospitalization, long-term disability, reduced quality of life, and death. Chronic illnesses account for approximately 75% of healthcare spending, with costs spanning both direct and indirect impacts. Direct costs include prescriptions, procedures, and healthcare services, while indirect costs arise from effects on employment, mobility, and overall well-being. Managing chronic diseases and multimorbidities is a complex challenge influenced by patient characteristics, healthcare systems, and providers. Addressing this requires structural changes at various levels, including reforms in medical education, health system adaptations, and updated guidelines. These changes aim to foster an environment that supports stronger therapeutic relationships and improves care outcomes. After this introduction, we are ready to tackle all the most important aspects and decisive challenges to launch an excellent telehealth service in our hospital. Until the next lesson. Goodbye.